alaikum. Adverse drug reactions. Let's start with the adverse reactions of biological agents. The first is infliximab, and of course biological agents being proteins must induce some allergies or immunological reactions, although they are used as anti-inflammatory and immunosuppressants. The reported adverse effects with infliximab include stomach pain, chest pain, chills, fever, common cold-like manifestations like cough, runny nose, sneezing. It induces also some respiratory infections like bronchitis or sinusitis. Dizziness, fainting also occurs, may occur with infliximab. Fatigue, weakness, and lastly, dyspnea, chest tightness, and difficulty of breathing. All these side effects occur together with some skin reactions. Here is a reported psoriatic skin reaction occurs upon use of infliximab. Other side effects of anti-TNF-alpha agents, not only infliximab, maybe adalimumab or other certolizumab also, may produce some uncommon adverse effects like reactivation of latent tuberculosis, severe infections of like pneumonia and joint infections, arthritis, thrombocytopenia, and lastly, increased instance of cancers like lymphoma and other cancers. Some rare side effects may occur, but not only thrombocytopenia, but sometimes pancytopenia occur, severe muscle weakness and seizures. The next agents, so there are many precautions must be taken before using anti-tumor necrosis factor alpha therapy, like for testing for tuberculosis, hepatitis C and B, check for heart problems, and regular complete blood count monitoring during the course of therapy. The other agents like ustekinumab or vedolizumab produce similar adverse effects also of inducing some immune reactions, some common cold-like manifestations, stuffy nose, sneezing, sore throat, injection site reactions, redness, hardening of skin, bruising, swelling, headache, tiredness, diarrhea, some general adverse effects that may occur with any biological agent used for any immunological disease. This is an example of palm skin reaction occurs upon use of vedolizumab. The other agent, natalizumab increases the instance of a disease called progressive multifocal leukoencephalopathy, and it's in fact it is a viral infection caused by a virus called JC virus. This virus affects the brain, especially in immunocompromised patients, because we know that all these patients receive immunosuppressive therapy before using the anti-TNF-alpha or for natalizumab or any biologic therapy. Headache, nausea, joint pain, and vaginal itching and discharge. This is the multifocal leukoencephalopathy. As regards side effects of older agents like 5-aminosalicylic acid and corticosteroids, we mentioned it rapidly. 5-aminosalicylic acid was associated with allergy to sulfur-containing compounds, which is a genetic predisposed disease in some patients who are allergic to sulfur, any sulfur agent, sulfonamide, 5-aminosalicylic acid, whatever. And also, sulfasalazine was reported to produce reversible male infertility, so it's not used in patients who are aiming to have children. Antibiotics, when used, produce its same adverse effects, but and especially in patients with inflammatory bowel disease, we must avoid use of broad-spectrum antibiotics. For example, ciprofloxacin, because this increases the instance of pseudomembranous colitis caused by Clostridium difficile infection. Especially in those patients because they have inflammation in the colon already, and also they receive other immunosuppressive agents, so it increases the predisposition for occurrence of this infection. This is the picture of pseudomembranous colitis occurs upon Clostridium difficile infection. All of us, of course, know the side effects of corticosteroids by mind, but for a rapid mention, it produces, of course, hyperglycemia, hypertension, abnormal fat deposition, obesity, truncal obesity, with thin extremities, redistribution of body fat to the abdomen, buttocks, buffalo hump, moon face with thin extremities, together with osteoporosis, muscle weakness, amenorrhea, and skin striae, and many other adverse effects that occurs, and predisposition also to infection, reactivation of latent TB. All these are reported side effects with corticosteroids. Lastly, the use of cytotoxic agents like Imuron or azathioprine or mercaptopurine produces the same adverse effects if it is used in any other indications or purposes, which include nausea, severe nausea and vomiting. It's cytotoxic, mucositis, mucosal ulcers of the GIT, mouth ulcers, GIT ulcers, coldness and numbness, alopecia, hair loss, and lastly, in higher doses or long-term therapy, it produces severe bone marrow suppression. Thank you.